Hi Shelby, my name is Erica and I'm a student physical therapist and I'm just going to be helping with your mom's physical therapy, and I just also wanted to let you know that I'm available if you have any questions about her recent non-Hodgkin lymphoma diagnosis, and that I know that you guys just found out about it, so I'm sure it's a lot, but that I'm here to offer any support and answer any questions if you have any.
Okay, thank you. That really means a lot. I'm still trying to take it all in and see what we're going to have to do for her. So I really
Yeah,
appreciate it.
yeah, I can imagine. What do you know about non-Hodgkin's lymphoma?
I mean, I know it's a type of cancer, but beyond that, I'm really not sure. All the doctors use these huge words, and I mean, could you maybe explain it a little more to me?
Yeah, of course. So the exact cause of non-Hodgkin's lymphoma is unknown, but due to research, I think it's due to some type of genetic abnormality that they're not really sure about. But it begins in the lymphatic system, which is responsible for just kind of moving fluid around your body and getting harmful toxins out of your body and that kind of stuff. So specifically with the lymphocytes, for some reason, just an abnormal amount begins producing, and then that's what leads to some different signs and symptoms of the cancer. It's actually the sixth most common cancer in America, and the average age of onset is around 66 years old. So it's a cancer that's normally found in older populations as opposed to children.
Okay. I'm still so surprised that my mom had it. I mean, she's been doing so great. And, I just so happened to kind of notice a small hard mass near her armpit when we were going shopping. And I took her to the doctor, and I just wanted to make sure, to get her checked out because she is getting older.
Yeah, no, that's totally great that you did that, because that's one of the common signs that people first notice that leads them to go to the doctor. It's common to find like little masses of lymph nodes that are kind of hard, but not necessarily painful in like your armpit area or even abdomen or neck. Some other signs and symptoms are that you have unexplained fever or weight loss or tiredness. There's also reoccurring night sweats and just an overall feeling of just like not like themselves, just really tired and exhausted, and even pain in those areas that I talked about, like in the armpit, or etc. Some risk factors that they have found for non-Hodgkin's lymphoma is that if you've been exposed previously to any radiation or chemotherapy, or if you have HIV or hepatitis C, or even if you have some type of autoimmune disorder like rheumatoid arthritis, for example.
Oh, my mom actually does have rheumatoid arthritis, and I had no idea that was a risk factor. But now that I'm kind of thinking about it, she has been losing weight and maybe is a bit more tired than usual. But I don't know how much you can really change that because she is getting older. So how are they going to be able to treat her?
Right. So, well, one of the ways that they diagnosed her was that they did the lymph node biopsy, and they also talked about doing a lumbar puncture just to look at some of the spinal fluid and stuff. But there's actual a staging system called the Ann Arbor staging system that has stages 1, 2, 3, and 4. 1 being kind of the earliest onset, to 4 being the most aggressive, and they're still determining that for your mom right now. And because of that, once they figured that out and just kind of how her body is in response to different things, that's how they're going to decide if she'll be doing radiation or chemotherapy. Sometimes they do combinations where they'll put her on some type of medication as well as chemo or radiation. If necessary, they maybe will look into surgery and stuff. But there's also something called plasmapheresis, where they will take away the plasma in her blood and replace it with healthy plasma to help her fight just what's going on in her body, as well as maybe potentially stem cell transplant. But yeah, that's something that the doctors will discuss with you more. They'll definitely recommend while she's in the hospital, and even if she goes back home or to outpatient, that she'll be in physical therapy, and that's what she's going to be seeing us for.
Okay. Sounds, good, but it also kind of sounds like a lot of medical things and interventions. So how is PT going to factor in with helping my mom?
Yeah, that's a great question. So as physical therapists, our goal is to make sure that she can still move around and that she can just get back to doing some of the things that she wants to be doing, and in that every time that we see her, or when we do her initial eval, we're going to screen her for if she has any weakness or just balance instability or anything that's going on with her gait. as well as some other things. And those are things that we're going to continually monitor, and that's how we're going to set our goals. If she's weak, we're going to work on her strength. If she's having trouble balancing or walking, like that's stuff that we're going to spend more time in. And so that's something that you can do too as a caretaker, that when you're with her, or like whether it's in the hospital or back home, that you can watch those things. And if you notice any sudden changes in those things, to notify us and her doctor, because that could be something going on with her medication or just the non-Hodgkins lymphoma itself. While she's in the hospital, we're always going to be monitoring some lab values, like her hematocrit, hemoglobin, and things like that, because if they get too low, that's a time where we won't do any type of exercise with her, because that would be unsafe for her. She would be more at risk for falling and stuff like that. So that's something we're always going to be checking with while she's here. Do you have any other questions or anything else we can help you with right now?
No, I think I've got it so far. I know she's really going to appreciate being able to get up and walk around. So I'm looking forward to our interactions in the future.
Oh, great. Shelby, it's so nice to meet you.
You too. Look at that.